if somebody is, struggling physically, at least they have a remedy for it and they can easily speak about it. But
Yeah.
struggling with mental health, I think that is a very big challenge for people only to, understand the scenario that they are going through. Most of the people, they are in depression, they don't even realize it. After maybe
Yeah.
months and years, when they get to know, then they are understanding that, oh, I was into depression from a lot of time. I think
Yeah.
you have also gone through so many scenarios, right, Dr. Kara?
Yeah. I actually, after I had my baby, I actually went through a period of postpartum depression myself, which I was kind of shocked by. So, that was really surprising to me. And it was the hormonal shifts and the sleep deprivation, that just really took a toll on me. And it really did help me to understand, what my patients go through in terms of how difficult it is. It was good for me as a doctor to go through that so that I could learn really how hard it is. I made it through, luckily. And now I'm back to my old self. But yeah, it was a really, trying time, and so I was, one of those mothers who went through that.
When doctors come up with their personal stories, then I think patients connect more with them. And
Yeah.
I hope, that this webinar is going to be helpful for a lot of patients and a lot of people,
Yeah.
who think that they are the only one who are suffering. But friends, I'll say that of course not. It's not going to, specifically or very less people are suffering. I think it can happen to anyone. What do you
Yes.
say, Dr. Kara?
Oh, yeah. I mean, it's very common for women to go through this. And, and anytime there's a big hormonal shift, it's common for women to experience, changes in their mood. And it's hard because women just don't understand, like, how is it that I feel so different, and it just happens. And there's really nothing shameful about it. But it is hard to talk about. So like I say, I'm actually kind of grateful that I went through it so that I can understand how my patients feel now.
And I think, being a woman itself is a very big challenge, and you cannot identify
Yes.
whether you're, whether it's your, like health wise, whether you are feeling sad, or is it actually the situation that went wrong and then you're feeling sad. It's very confusing. You
Yeah.
can understand a lot of things.
I feel like becoming a mother is a complex thing because it's a developmental shift in life. You're now responsible for this baby. You're not sleeping through the night. So that has a huge toll on your mental health. Your progesterone levels were very high and now they plummet. Mm-hmm. So there's a major adjustment in hormonal balance. Men, depending on who you married, sometimes can be helpful, sometimes not. So there's that. Family can sometimes be helpful, sometimes not. And, depending on what culture you're from, you might be getting help or not. And in American culture, I think women tend to be kind of isolated when they first become a mother. I think in like Indian culture, it sounds like women tend to be a lot more supportive of each other when they first become a mother.
Yeah.
But for me, I was kind of isolated, and that probably contributed. So, I think everybody has a different experience. And so, luckily I did get treated, for it, which was very positive and was very eye-opening for me in terms of what it was like to be a patient and to go through that. And I made a full recovery, and my daughter is doing really well too. So it all turned out fine. But, postpartum depression is a pretty complex psychosocial, biological, mental health issue.
Till then, do not forget to like, share, and subscribe to our channel. And thank you so much for being here. See you next time, everybody.